Welcome to another segment of ACRP TV. Today, our spotlight is an ongoing segment we're doing calling Getting Beyond Buzzwords. In this case, we're looking at a very popular one right now. Patient engagement means a lot of things to a lot of people. Sometimes it's just two words strung together. We want to get beyond that and burrow down a little more deeply. We've got a great guest today. Halley Losekamp is the Director of Patient Enrollment at AGTC. Halley, thank you so much for joining us today.
Thank you.
Now, you're obviously somebody who knows something about patient enrollment and recruitment and dealing with patients, what's real, what's just words. Let's start off with what patient engagement means to you.
Sure. So I think clinical research by nature, it has a patient engagement touch to it. But I think to myself, I believe that patient engagement is getting eye level with the patients. And it's really understanding where I sit in terms of patient recruitment, understanding who that patient is on their day-to-day lives, who they see as a physician, what impacts them, their families, their children, their future, and how do we engage them on a level that lets them know that, hey, clinical research really could be an option for me, and drives that clinical research as a care option home. So it's engaging them as a stakeholder. Obviously, you can do that from inception of a study at a protocol level, all the way through to the closeout of a program. But to me personally, it's really engaging them on a really humanistic level and understanding who they are and what drives them day to day and what could drive them to engage in a clinical trial, which is a really hard thing to actually do for patients because so few patients actually do engage in clinical research.
And you talk about how hard this is. That's sort of a segue into my next question. I'm a journalist. We're supposed to be cynical and skeptical, and I sometimes roll my eyes when people throw around different terms like patient engagement and centralized trials and things where some people are just sort of saying the words. And I know you're very committed. I'd like to talk about sort of getting beyond saying patient engagement and rolling up our sleeves and really improving how we do this. You've touched on it a little bit, but can you talk a little bit more about what patient engagement really means to you beyond the term?
Yeah, so I think it's, it's actually talking to the patient. I think what happens a lot of times is vendors, groups, sponsors, pharma companies, sites, they all say, yes, we're patient engagement. I think in this day and age, if you don't say you're patient engagement, or you have some component of patient engagement being patient-centric, people kind of look at you or side eye you, right? So there's this pressure to say that you have that patient-centric approach, but actually doing it is a completely different thing. And, there are ways to do it. If you have a big budget, right, that really opens the door for you. But if you don't have a budget or the resources, there's social listening. You can send surveys. There's patient advocacy groups on a national level, on a local level. So there are really easy ways to get involved with patients and connect with them, but it means actually doing that. Like I said, it means getting on eye level with the patient and actually talking to them and including them as a stakeholder in every process or facet of the clinical trial planning and execution.
Well, I love that term eye level and also the commitment to communication, because again, as you said, as we say in the industry, it's easy to say patient engagement. There's some pressure to say it because it sounds good, but it really is a matter of just talking. And connecting with patients. And it sounds obvious, but as an industry, we don't always do it. So I really appreciate you raising awareness for us of this today and giving us some specific ideas and ways to better connect with patients. So I really appreciate your insights, very valuable for our audience. This has been ACRP TV Spotlight on Getting Beyond Buzzwords. Today, we've been talking about patient engagement with our guest, Halley Losekamp, who is the Director of Patient Enrollment at AGTC. Halley, once again, thank you so much for joining us today.
Thank you.